Anterior cruciate ligament. In this type of injury, there is rapid deceleration or pivoting of the lower extremity with foot planted, and the symptoms are pain, rapid onset, and it may be severe, and there's a popping sensation which can be heard on injury. Swelling, it can be by effusion or hematarthrosis, and joint instability is seen. Examination, there is anterior laxity of tibia related to femur. There is anterior Droy test and Latchman test. Diagnosis is by MRI and treatment is by RICE, that is rest eyes compression and elevation, and surgery may be implicated.